Hi, my name is Brian Verla. This is my second video topic over pulmonary function testing. Let's go. Explain how you would interpret a pulmonary function test by looking at the FEV1, and FEV1%. So this is our first topic outline for this video. What you want to do is first assess the FEV1 over the FEVC ratio. Since a ratio below that 70% can suggest a respiratory lung disease, most time it is. Then evaluate FEV1% and FEVC% to determine the severity of the obstruction or restriction. FEV1% below 80% indicates airflow obstruction, while FEVC% below 80% suggests restriction. That's usually how it goes as well. So what are the normal values in regards to this? So a normal of a ratio of 70% or higher and an FEV1 and an FEVC within 80% of a predicted range indicates normal lung function. Again, if that ratio is 70% or higher in FEV1% and the FEVC is within 80% of predicted value, then we should indicate that they have a normal lung function. The thing is, for obstruction lung diseases, you could have a ratio below 70%, and that could suggest an airway obstruction, meaning the patient has a difficult exhaling air from their lungs. The degree of obstruction is further dimensioned by the FEV1% value. So as long as you can see there from those values, you can make a determination. Oh, it could be this, it could be that, it could be obstruction, it could be a mix, it could be just restrictive. So restrictive lung disease is a normal FEV1 over FEVC ratio, and it must be 70% or higher. With a reduced FEVC and FEV1 may indicate restriction. So you're not getting enough air, it's too constricted. This means the lungs have difficulty expanding fully and limiting the total volume of your air exhaled, and even though the rate of exhalation FEV1 is not severely. So interpreting the results, a normal FEV1 over an FEVC ratio and a normal FEVC and a normal FEV1 indicates normal lung function. Obviously, if everything's normal, then across the board it's going to be normal. But if you have a low FEV1 and an FEVC ratio with a normal FEVC, then you're indicating airway obstruction. Usually that's going to be patients of COPD and asthma. So a low, and let's keep in mind, a low FEV1 and a FEVC with a low FEVC suggests a combination of obstruction and restriction, or possibly a restrictive disease with air trapping. That's also something you want to see. Again, if your patient comes in on a ventilator, you're not going to notice it too quickly, but eventually it will be seen. A normal FEV1 and an FEVC ratio has a low, or if it has a low FEVC, suggests restriction, and pulmonary fibrosis is an example of that as well. So to reduce FEV1 and a normal FEVC can indicate asthma, bronchitis, emphysema, bronchodilator responsiveness, and help differentiate between these. So how do you identify / determine a diagnosis of a restrictive or obstructive pulmonary disease? So if it's obstructive, the spirometry reveals a low FEV1% over an FEVC ratio and indicating a difficulty exhaling of air quickly. The FEV1 forced expiratory volume in 1 second is the amount of air a person can exhale, that indicating a difficult, I lost my tracks. Spirometry reveals a low FEV1 over an FEVC ratio, indicating difficulty exhaling air quickly. So the FEV1 is the amount of air a person can exhale in 1 second, while the FEVC is the total amount of air exhaled forcefully. So a low ratio means a significant amount of air remains in the lungs after an exhalation, a hallmark of obstructive diseases like COPD. So a lung So lung volumes are typically increased, especially the total lung capacity, the functional residual capacity, and the residual volume. This increase is primarily due to air trapping caused by the inability to forcibly exhale due to airway obstruction, leading to hyperinflation of the lungs. So restrictive, spirometry shows a reduced lung volume, specifically a low FEVC, while the FEV1 over the FEVC may be normal or even elevated. This indicates that the lungs are not able to forcibly exhale all the air, making it difficult to inhale enough air, which is characteristic of a restrictive condition of pulmonary fibrosis. So, what part of the pulmonary function test is utilized to determine severity? The severity of lung disease is determined primarily using the forced expiratory volume in 1 second, and it's a measurement from a pulmonary function test, specifically the FEV1, often expressed as a percentage of the predicted value, is used to stage and assess the severity conditions like COPD. So severity levels of airflow obstruction based on FEV1%. What you're going to have is a mild, moderate, severe, and then a very severe. So if you're mild, your FEV1 is over 70% predicted. And again, that needs to be between that 70 and 80, preferably over 80. If you have a moderate, of your FEV1 will be between 60 and 70. Moderate severe, 50 to 60. Severe, 35 to 50. And anything less than 35 is very severe, or really for those heavily chronic patients that are most likely at the end stage of life or are needing a lung transplant. You have the American Thoracic Society criteria here, and then you have the GOLD criteria, and that kind of just shows what they're mild, moderate, severe, very severe, and how the American Thoracic Society has more detailed levels of that obstruction. So you have that mild, moderate, severe, very severe, while the GOLD criteria only has a mild, moderate, and severe, and then a very severe. Usually those are best used for COPD patients as well. Here are my sources that I use for the gathering information. I did also use my respiratory exam booklet as well. Alrighty, I thank you for listening in and tuning into my video presentation. You have a great day.